Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Okay, let's unpack this. In today's deep dive, we're reviewing content developed by Dr. Michael Jones, who's a licensed professional counselor, a counselor educator, and a nationally recognized trainer in telemental health.
And just a quick note for you listening. While this audio is generated for accessibility, the ideas and all the content we're discussing are authored by Dr. Michael Jones.
Right. So our mission today is to really explore how telemental health, TMH, can act as a tool for public health equity. We're focusing specifically on communities that have often been underserved, thinking about Black, Indigenous, and people of color, BIPOC populations. All our insights are coming directly from the materials Dr. Jones has put together. So we'll be looking at the obstacles these communities face getting mental health care.
Yeah, the barrier.
Exactly, the barriers.
Yeah.
Then how TMH might, help address some of those. Also diving into the really important ethical side of things.
Sure.
And being honest about the challenges that are still out there. Making sure TMH works for everyone.
And what's really fascinating, I think, right from the start is how Dr. Jones frames this. It's not just clinical treatment. He positions mental health squarely within public health and equity.
Okay, so why that frame? Why is looking at it through a public health lens so important when we talk about access, especially for BIPOC communities?
Well, because as Dr. Jones explains it, shifting to a public health view changes the focus fundamentally. It's less about, say, treating one person's depression and more about promoting and protecting the health of entire communities.
Right, population.
Populations, exactly. You mean thinking about organized efforts, prevention strategies, making sure care is actually accessible, improving outcomes across the board, and importantly, it means tackling those systemic issues.
The bigger picture stuff.
Yeah, the social determinants of well-being, like poverty, like discrimination, environment, things that affect whole groups of people. It's just a much broader view than the traditional clinical model.
Okay, so that public health perspective immediately throws those disparities into sharp relief, doesn't it? It shows they're not just individual problems, but systemic ones. And Dr. Jones's material, it really highlights specific obstacles for BIPOC populations. What are some of those key barriers to mental health care, he points out?
He lays out quite a few, and they're pretty deeply embedded. You've got practical things like transportation. Just physically getting to an appointment can be a real challenge.
Sure, yeah.
And there's a huge one, provider shortages, especially in rural areas, but also underserved urban neighborhoods. Just not enough therapists to go around. And then you get into the social and systemic stuff. Stigma around mental health is still incredibly powerful. Discrimination, too. Cost is a massive barrier, and insurance gaps. We're just not being able to afford care.
Yeah, affordability is key.
Definitely. Plus, cultural and language mismatches. Finding a therapist who really gets your background, that can be tough. And we can't forget the impact of historical trauma within these communities.
Sure.
It all adds up, creating layers that stop people from even seeking help or, sticking with it.
That really paints a challenging picture. So this is where the conversation in his material pivots, right, towards telemental health, TMH, as a potential way to get around some of these hurdles. How does Dr. Jones suggest TMH actually helps?
Yeah, this is where it starts to sound quite promising. Dr. Jones's work really highlights how TMH can pretty effectively dismantle some of these structural barriers. Take geography, for instance.
Right.
TMH basically makes distance irrelevant. If you live miles away or there are no specialists nearby, suddenly you have access to a much wider network of providers. That directly tackles the shortage issue.
Okay.
And think about stigma. Getting care in the privacy of your own home, that can feel a lot safer, maybe less daunting than walking into a clinic.
Yeah, that makes sense. A sense of anonymity, maybe.
Exactly. And because the pool of providers is bigger, it also increases the chances of finding someone who's a good cultural fit or speaks your language.
He includes some case snapshots in the material to illustrate this, doesn't he? Make it more concrete.
Yes, he does. And looking at those case snapshots provided by Dr. Jones, they really show the impact. Like there's one about a 14-year-old kid in a rural area. 0 local providers, just none.
Wow.
So the barrier was pure geography, provider shortage. TMH was literally the only way this teen could get weekly therapy. Essential support for school, for family stuff. It just wouldn't have happened otherwise.
A direct link.
A direct link. And another one, an adult client with MS. Huge physical challenges, transportation barriers getting to appointments. TMH meant consistent, specialized care right from home. It overcame mobility issues that made traditional therapy almost impossible for them.
So these aren't just anecdotes about convenience. It shows TMH actively creating access, specifically for people hitting these really tough logistical and social walls.
Precisely. And Dr. Jones really stresses this point. For TMH to properly serve BIPOC and underserved groups, it can't just be generic. It needs intentional design. It needs to be trauma-informed, culturally responsive.
Okay, that term equity comes up in his glossary. How does that tie in?
Right. According to Dr. Jones's glossary, equity isn't just about giving everyone the same thing. It's about meeting the unique needs of different groups to ensure fairness and health outcomes. It means actively taking down those systemic barriers we talked about. And TMH can help do that, especially by making that culturally responsive care more reachable.
Let's dig into that a bit more then, the culturally responsive care piece. Why is that so vital when we're talking about TMH for BIPOC communities?
Well, as Dr. Jones discusses in his overview, it's absolutely fundamental. Culturally responsive care means the therapist actively acknowledges, respects, and weaves the client's cultural background, their values, their beliefs, their lived experiences into the therapy itself.
It's not an add-on.
No, not at all. For BIPOC clients, especially given potential past negative experiences with healthcare or systemic racism, this kind of culturally affirming approach is key for building trust. It creates psychological safety. It empowers them. And TMH, you see, has this unique potential because it blows open the geographic limitations.
Right, widening the pool.
Exactly. It boosts the odds of connecting a client with a therapist who maybe shares their cultural background or speaks their language. And that connection, that cultural and linguistic concordance, as Dr. Jones calls it, is a really strong predictor of whether someone engages in therapy and gets good results.
So it's not just finding any therapist, but finding the right one, someone who gets your context. Does his material give specific examples of TMH being designed this way?
Yes, he does. He cites some really interesting examples from the research literature. One is called the Shock Talk application. It was specifically created to link urban indigenous clients with therapists who shared their cultural background. They even used platforms like Facebook Messenger, meeting clients where they already were, technologically speaking.
Clever.
Yeah, very practical. Another example is the POT-RNV model. This one uses cultural safety frameworks, works closely with community leaders to provide telehealth for rural Native veterans. So these aren't just off-the-shelf TMH platforms. They're intentionally built with cultural needs front and center, designed to boost engagement, reduce those disparities.
That's really powerful evidence that it can be done, that you can bake that responsiveness in. But okay, beyond these specific models, is there wider evidence? Does TMH generally show effectiveness for these populations?
Yes, according to the empirical evidence Dr. Jones references, there is support for its effectiveness. For example, some studies looked at that huge rapid shift to telehealth during the pandemic.
Right, everyone went online.
Exactly. And they found things like fewer missed appointments and better outcomes for depressive symptoms, specifically among low-income minoritized groups using telehealth. There's also research showing good results for things like trauma-focused CBT adapted culturally when delivered via telehealth to kids from underserved areas. So these findings, reported by Dr. Jones, suggest that yes, when TMH is implemented thoughtfully, equitably, it really can lead to positive clinical results for these specific populations.
It really does sound incredibly promising, tackling access, engagement, but, you know, technology is rarely a perfect fix. Are there still big challenges, things TMH introduces or doesn't solve? You mentioned the digital divide earlier, which Dr. Jones highlights.
Absolutely. That's a huge caveat. TMH is great at overcoming distance, but it creates these digital hurdles instead. Dr. Jones defines digital equity in his glossary. It's the condition where everyone actually has the tech capacity needed to participate fully.
So not just having a phone, but right.
It means reliable broadband internet,
Right.
a suitable device, a computer, a tablet, maybe a smartphone that works well enough. And, crucially, the digital literacy, knowing how to use it all effectively. The hard truth is there are massive inequities in all three areas, especially affecting low-income folks, people in rural areas, sometimes older adults. If you don't have stable internet or a decent device, or you're not comfortable using the tech, TMH is effectively locked off to you. It could actually worsen existing disparities.
So it risks leaving people behind if we don't actively work on bridging that digital gap.
Precisely. And Dr. Jones's sources also point out another issue. Sometimes the telehealth tools themselves haven't been designed with diverse users in mind. They might lack cultural relevance or just not be easy for everyone to use. Getting past this isn't just about technology distribution. It's about building real community trust, collaborating respectfully, as he emphasizes, designing solutions with communities, not just deciding for them.
Beyond those practical tech issues, Dr. Jones makes a really strong point about the ethical side, the responsibilities professionals have regarding equitable TMH. What's the core message there?
This point, drawn directly from Dr. Jones's work on public health equity in TMH, is absolutely central. He argues that striving for equity in TMH isn't just, a nice idea or good clinical practice. It's actually an ethical requirement for counselors and mental health professionals.
An obligation.
Yes. He points to the professional standards from big bodies like the ACA, NBCC, KAC. Their codes of ethics include fundamental principles about promoting client welfare, respecting diversity, ensuring counselors are competent with digital tools, upholding non-discrimination, and actively pushing for social justice.
So working towards equitable TMH isn't optional, it's baked into the professional code itself.
That's exactly the point Dr. Jones makes clear in his discussion. These ethical guidelines basically compel professionals to actively identify and work to remove those barriers we've discussed, particularly for BIPOC clients using TMH. It frames the whole push for equity not just as beneficial, but as ethically necessary.
Okay, so given that whole picture, the huge potential, but also these significant challenges, the digital divide, the ethical mandates, what does Dr. Jones recommend? What's needed to make TMH truly equitable and effective for everyone?
Well, based on his analysis, Dr. Jones lays out a pretty clear path forward, focusing on intentional action. The recommendations cover several areas, things like concrete steps to expand access to the technology itself.
Yeah, like broadband expansion?
Exactly. Advocating for better broadband infrastructure, supporting programs that provide devices, offering digital literacy training. That's foundational. Then, prioritizing the design piece, creating culturally informed platforms and interventions. And this is key, ensuring they're developed with real input from the communities they're meant for. Co-design. Absolutely. Partnering with existing community organizations is also highlighted as essential. They often have the trust and the reach needed. He really hammers the point. Telehealth solutions must be developed with and for the people they aim to serve. And finally, policy support is crucial funding for culturally grounded care and making sure there are ways for communities to give ongoing feedback.
So it's not just one thing. It's tech, design, community partnership, policy, a whole ecosystem approach.
It really is. Dr. Jones's work ultimately concludes that, yes, TMH offers a genuinely promising route towards greater mental health equity, particularly for BIPOC and underserved communities. And it's a big but. Its success depends entirely on how we roll it out.
The implementation matters.
Hugely. It demands intentional, inclusive strategies that genuinely center cultural responsiveness, actively tackle systemic barriers like that digital divide, and proactively work to build or rebuild trust, especially in communities with historical reasons to be wary of healthcare systems. So TMH approached with cultural humility, a real commitment to digital equity, and strong ethical rigor. That, he suggests, can be a tool for justice, something that helps dismantle inequities instead of just replicating them online.
That's a really powerful way to frame it. It elevates TMH beyond just convenience, positioning it as a potential lever for real change in mental health access, but only if we're incredibly thoughtful and deliberate about it.
Right. The technology enables, but the equity comes from the intention and the action around it.
This deep dive was based on the original work of Dr. Michael Jones, thinking about everything we've discussed, especially that critical piece around digital equity needing the access, the device, the skills for TMH to actually benefit everyone. What specific steps could you, listening right now, imagine your own community or maybe local services taking? How could they help bridge that digital divide and make culturally responsive TMH truly accessible to all who need it in your area? That's definitely something to mull over as you continue your own deep dives.